Health workers on the front line of the coronavirus outbreak in the US are under mounting pressure from their hospitals to remain silent about the shortage of medical equipment and protection measures.
Help us help you. The CDC has abandoned us. The government has abandoned us. Our hospitals have abandoned us. We know that our public will not abandon us.
Many say they were forced by their hospitals to work when they were unprotected, sick, and even infected by coronavirus.
I was tested positive for COVID-19, and I'm ready to back work now. They don't care. If you can move your hands, if you can walk, if you can talk, come back and work for it and make people sicker. It is outrageous.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament.
We are transmitting the disease to our family members, the patients who are negative for COVID-19, and we are spreading this disease to the community from this right hospital.
With mounting numbers of COVID-19 infections in the country, the US Health Department has stated that hospitals nationwide have insufficient capacity to handle the surge of coronavirus patients. Grim headlines are circulating in the media warning from a bigger challenge on the way. The phase that health workers are fearing the most is the apex, when the daily number of new infections are at the high point of the curve.
We've been talking about hitting the apex, and that is the ultimate challenge for the healthcare system. Can we handle that number of cases at the high point of the curve? We're not yet ready for the high point. We're still working on the capacity of the system. The more time we have to improve the capacity of the system, the better. And the capacity of the healthcare system, beds, staff, equipment.
But the shortage of equipment and spaces in hospitals is not only causing doctors to fear for their safety and the safety of their patients, but also to fear being sued for neglect.
We are in a situation where we have to be able to save the most number of lives, and we just can't be in a situation where people who don't have to make those decisions are sitting back in their chairs and saying, let me see if I can shake that tree for money. I don't think most lawyers are like that. I think that most lawyers are not like that. But I think that sometimes our better natures are encouraged by good policy.
The fact that hospitals are putting in place recommendations and guidelines where somebody is in a hospital and might be able to be treated, but is not because they don't have enough resources for everybody. In a normal circumstance, that would be obviously the basis for a lawsuit for liability. It's a very scary time, and hospitals and doctors are being confronted with all these things.
The US is facing shortage of medical protective equipment across the country, and authorities are saying they are trying to provide for the mounting demands.
It flipped. Nobody expected the need of equipment that we have. Nobody diagnosed or suggested PPE shortages. We were focused on beds early on, and we scrambled on the beds, but now it turns out it's PPE and masks and ventilators.
Amid shortage of equipment, some health workers have lost their jobs for speaking out. This emergency doctor in Washington was suspended from work after pleading for more safety equipment and protective measures. A spokesperson for the Washington State Nurses Association told Bloomberg that hospitals are muzzling nurses and other health workers in an attempt to preserve their image.
We are told that they are searching for more PPE. Today I stand with the nurses to call upon Donald Trump, upon our local and our hospital leadership, to stop looking for PPE that doesn't exist and start producing it. We are past the point of last resort.